we're going to, I guess, come back to earth a little bit and talk about preoperative testing. So really, we're going to talk about the H&P and some specific instances where you order various testing. And this is going to, you can think this is really obvious and easy, and maybe it is to some of you, but in my experience, this is what is currently happening is not necessarily what we should always be doing. So why do that? So you want to detect unsuspected abnormalities, right? These are things that are going to crop up without you realizing that they're going to happen. You want to establish medical risks, and then you also want to have some medical legal protection, right? It's not so good to do that bunionectomy and then have the patient die on the table. It's not exactly good for your malpractice insurance. Okay, so what should you do? You order a chest X-ray if there are signs or symptoms of active chest disease. So if the patient's telling you about some issue, they have asthma, they have some pulmonary disorder, something along those lines, then you might get the chest X-ray. You might get other testing as well. Okay, what about a CBC? This is probably the most common test. Everybody just throw it in there. It's a CBC. It's easy, whatever. Routine testing of this leads to management changes in up to 2.7% of patients. That's pretty low. Can you imagine the last patient that you had that was undergoing a surgery who had some abnormal value on their CBC and you canceled their surgery because of it? I can't. So this one, on the other hand, is a bit different, right? Now, if it's emergent, you have limited ability to work up your patient. So in this one, he's probably going to be in the hospital. He will already have received a complete metabolic panel, along with everything else, the A1C, that's all going to be there. But if you're ordering the tests, really you focus this on the fact that they're diabetic and that they have cardiac disease. What's really more important than ordering the tests is making sure that the cardiac risk index is low enough and then having any kind of workup for that you need.